Today our topic is mainly it's in everyone's mind: overexertion and heart health. Whether doing exercise is safe or not. Like why we are seeing a lot of young people who are doing exercise and having sudden cardiac. So let us have a brief knowledge about what will exercise, how will the exercise help our heart, and like how do we take the exercise to from one level to another level, and what all ages, or whether if there is any limit, whether if what problems if you have, whether you go into that, or do you need to restrict yourself to do exercises, whether if it's safe for everyone or not. We just need to know like what actually the exercise, how actually the exercise helps you. So how exercise helps our heart health? It mainly helps in maintaining your blood pressure by improving the blood volume per beat, and even by improving the blood glucose level, improves the blood vessel health, and a stronger heart functions more efficient. So the additional benefits along with this regular things, mainly when we do the exercise, it improves the muscles' ability to pull oxygen out of the blood. So it will give your muscles means it comes the whole part. Even the heart is a muscle, and the body muscles in your entire body, everything. When you're exercising, it pulls more oxygen out of blood into the muscle and reduce the need for the heart to pump more blood to the muscles. So a person who sits ideal, or who doesn't have regular activity, or not doing regular exercise, so their normal pulling capacity of oxygen out of the blood into the muscles will be much lower than people who does regular exercise. And it reduces stress hormones that can put an extra burden on the heart, and it acts like a beta blocker. Beta blocker is one drug which we generally give for patients to reduce their heart rate. So when you do regular exercise, when your exercise, moderate intensity exercise also is enough to maintain your heart rate at certain level, so that acts as a beta blocker, and it slows the heart rate and lowers the blood pressure. So, and it also increases the high density lipoprotein. High density lipoprotein is one thing where most of the patients, they used to ask like how to increase my high density lipoprotein, whether to eat sufficient good amount of fatty acids, and how to improve that. Actually, even when I'm using the medications, the LDL is coming down, but the HDL is not improving. So exercise and good diet, these both go along with each other, and it helps by increasing the good cholesterol, that is high density lipoprotein, and it helps control triglycerides. So how exercise helps our heart health? So it helps to fight the battle to quit smoking. So when we are trying to quit smoking, the withdrawal symptoms and cravings for cigarette, it decreases during exercise and up to almost 50 minutes after exercise. So regular exercise, when you want to quit smoking, regular exercise will help you to reduce that craving, that need to have nicotine in your body. So regular exercise along with the de-addiction medications or de-addiction exercises, all these things will help. It's a great help for your body and your heart. So exercise decreases appetite and helps limit the weight gain some people have when they quit smoking. So that is also one of the important thing while doing exercise, not only for smoking people, even for the normal individuals, and it will give you a good strength and makes your ability to increase. So it's exercise, it aids in pre-existing conditions. It reduces blood pressure in people who already have blood pressure. It aids in cardiac rehabilitation after a cardiac event. So that is very important. When once the patient had a cardiac event, and then after post-cardiac rehabilitation and exercising, and means like not intense exercise. So initially gradually increasing the intensity of the exercise, maybe to a certain amount, certain phase of exercise, maybe modern intensity. So that will help your heart and overall body. It makes your heart muscle like grow much strengthened than the pre-existing phase. It helps to improve cholesterol, as last time we are telling, it reduces bad cholesterol and it increases the good cholesterol. So it controls weight. So obese individuals require more blood to supply oxygen and nutrients to their body, which causes an increase in blood pressure. Because of our bodies, it requires more pressure to circulate the blood. So that's why obese people, genetically they may be obese, they may not attain thin structure. But when they do this regular exercise, it helps for the metabolism. It helps to increase supply, for better supply the nutrients to the body parts, muscles, and all the organs. So high blood pressure is also a common cause of heart attack, which is more common for obese individuals. So it builds stronger immunity. Regular exercise can boost your immune system and helps fight off infections. It allows immune cells to perform effectively. It increases blood flow, decreases inflammation, and can strengthen antibodies. So as we're discussing, when we are pulling more oxygen and the metabolic system, which is functioning better than a normal individual, so that's where your immunity also increases. So this exercise, the regular exercise, it helps you to be a stronger immune person than being idle. So how much and what kind of exercises will help for your heart? So you should initially, so you should one thing is you need to assess yourself. You need to see what all the basic health conditions you have, or if you're free of all the basic health conditions. And the goal is to work up at least 30 minutes, 5 days a week, or 150 minutes a week. That is around 2.5 hours of moderate intensity. And I'm telling you that this is like moderate intensity. It's not that you have to go reach till moderate intensity, but the workup, you can just limit your timing. Minimum basic is 3 days in a week at least, but ideal is 5 days a week of 30 minutes workout or exercise or any sort of physical activity. So especially at first, the exercise, it can be divided up to 10 minutes in the morning and 10 minutes later, and has its own benefits. In any kind of exercise that increases our normal heart rate, even a little bit helps. Whether it can be jogging, skipping, it can be a swimming, it can be bicycle riding. So all these things will help increase our normal heart rate, and it helps to improve our heart health. So choose exercises that you enjoy, so it will be easier to stick with it. So according to the WHO World Health Organization guidelines, as I was telling you, that 150 minutes average with moderate intensity, or 75 minutes with vigorous intensity. So per week, if we put that as at least some, it's not about target, at least like to reach that goal. That goal will help your body, your heart, and your metabolic and immune systems to work much better than what actually it is before doing the exercise. So how exercise helps? Do I have to run? Because I'm not going to run, not even if my life depend on it, there will be no running. So you should, it's not that you have to run there. As I was telling you, whatever you like to do, that there are so many different type of exercises, or playing. Even if you want to play a game, you need to exercise to have that strength, to have that pace to play for a longer time. So this is a part and parcel of your exercise capacity, and increasing the intensity slowly. So whether you can run, or you can do low moderate intensity exercises, you can do swimming based on your BMI, all these things. It's not just cardio what I'm talking about. You can do all other different sort of exercises, whichever will increase your heart rate to certain amount, and based on that, later I'll tell you like what is the intensity. As we are telling you, mild intensity, moderate intensity, severe intensity, and vigorous intensity of exercises. So what is it like? How we differentiate the intensities, and at what age, what intensity we need to like differentiate?